Assalamualaikum. Hi. Today we're going to talk about osteoporosis. I got to treat a patient who was osteoporotic, so I thought that its awareness should be highlighted. So I'm making this video. So osteoporosis is basically a disease that weakens the bone to a point that they can break easily. And in the pic, you can also see that there are two hip joints, and one of them is porous, shallow, while the other one is normal and dense. So this shows that it's such a disease, it's such a deadly disease that it makes your bone weaker and it X it resorbs the minerals from inside the bone to the blood outside of the bones. So and the thing about it is that it's so deadly that a person doesn't even know that he has osteoporosis until some injury occurs or he goes to a doctor to understand what his condition now. So it's basically a silent disease. So, what is the etiology of the osteoporosis? So, osteoporosis activity of bone to maintain itself, and the bone maintains itself through help of some cells. As we all know, that bone is an organ, so it's made up of tissue, bony tissue, and the bony tissue is made up of cells. We have osteoblast cells that are bone remodeling, bone making cells. They make the new bone, and when a child is developing from childhood to adulthood, these cells play a major role in longing the bone and increasing the density of the bone and circumference of the bone. And then we have the osteoclast cell. These are the bone absorbing, tissue absorbing cells. They basically absorb, they basically remove the previous bony tissue cells so that the new cells can be formed. So osteoclast cell basically does that. And then we have the osteocytes. These are the bone cells that maintain the bone. So this was a very brief review of what osteoporosis is and what cells are responsible for causing osteoporosis. So mainly the osteoblast cell become diminished in this disease, in this particular disease, and this all happens due to some conditions, some factors that originate this disease. So we have an osteoclast hyperactivity and an osteoblast diminished activity. So what are the two types of osteoporosis? Osteoporosis is primary and secondary. In primary osteoporosis, we have no known cause, but there are some contributing factors to this disease, like negative calcium balance, impaired gonadal and adrenal gland function, estrogen deficiency, sedentary lifestyle, and it's explained in these types that we have post-menopausal, meaning in aged women, and senile people, meaning those people who are aged, and then we have idiopathic juvenile osteoporosis that is in children. So these are the types, and then we have the senile people, meaning those people who are aged, and then we have idiopathic juvenile osteoporosis that is in children. So these are the types, and then we have the secondary type of osteoporosis. This type is basically due to some known cause, either due to medication use or due to some disease like comorbidities, or due to uh, some inhibition of calcium absorption or malnutrition due to absence of calcium in the blood as well as the bone. So these are the factors. Now it's explained a bit. The secondary osteoporosis origin, we have endocrine origin, meaning that if a person is hypergonadism, he has this, or he has cortisolism, which is basically the hypergonadism means that a person who has a high hormonal secretion of all endocrine gland, and hypercortisolism means a person has high cortisol. Cortisol is basically a hormone from the pituitary gland, and that regulates stress. So if a person who is always in extreme stress, he will have a high amount of cortisol in him. And then we have hyperthyroidism and hyperparathyroidism. So these are all the endocrine glands. Their hyperactivity can lead to osteoporosis. Then we have gastrointestinal disease, where we have chronic inflammatory bowel disease, IBD, malabsorption, malnutrition, primary biliary cirrhosis, and lactose intolerance. So there we have that. And then we have rheumatological and connective tissue diseases, inflammatory diseases, hematological and neoplastic diseases, and then we have medications. And the most medication that harms and lead to this osteoporosis disease is glucocorticosteroids. Okay, now we're going to move on to the risk factors. So, what are the risk factors? They are basically advanced age, meaning a person who, if does not take a large amount of medications or doesn't have any disease or something else going on, then What are the chances? Will he get osteoporosis? Maybe. He might get primary osteoporosis because it has no known cause. So advanced age, and we have, and then we have ethnicity, and then we have genetic factor. Amenorrhea is a condition in females, and then we have physical activity, alcohol and tobacco use, and low calcium or vitamin D deficiency. So how do we diagnose a person, or how does a doctor diagnose a person who is osteoporotic? So we have X-ray, we have DEXA, which is a dual energy X-ray absorptiometry. Then we have the DEXA scan. The DEXA DEXA scan is basically bone density test. So if a person who does this scan and receives a test of -1 or above, then this means his bone is normal. If a person receives a score of -2.5 or 3, then he is osteoporotic. Then we also have laboratory assessment tests in which we assess renal and thyroid function and vitamin D and calcium levels. And then we have Frank's test. So what is Frank test? It is a fracture risk assessment tool. These are basically questionnaires. It's a portfolio of questionnaires where the patient is asked a list of questions, and if he gets a particular score, then that score will tell that he is osteoporotic or not. So, what are the sign symptoms if a person is osteoporotic? So, a person who's osteoporotic will show back pain. He will have chronic episode of back pain, and this is the reason why there are a lot of compression fractures or hairline fractures observed in old age patient, and specifically on the spinal level. And then we have compression fracture. He will have some sort of fractures on some areas of the bone of the body. Then we have decreased height. A person who is osteoporotic will have decreased height. He will have kyphosis and increased thoracic curvature. He would have Dueger's hump. Dueger's hump is basically similar to the increased thoracic curvature, and decreased activity tolerance, meaning he would be inactive a lot, and early satiety, meaning he would feel fullness in eating very early while he's consuming food. So, what are the medications? What are the medications prescribed to such a patient? We have bisphosphonates, which are tablets in tabular form. Then we have denosumab, which is 6 monthly injection. Then we have SERMs. It's basically medication which is given to female. Then we have hormonal replacement therapy. Then we have teriparatide, which is basically an injection which is given for 18 months. And this was the injection that the patient I treated was prescribed by his doctor to him. Then we have romosozumab. Some of the names are obviously very hard to pronounce. Well, I do I do my best to try to be honest with your names. This is a monthly injection also. Then we have some medications that are also prescribed to osteoporotic patient other than the major ones, and they are painkillers, multivitamin tablets, omeprazole, vitamin D tablet, and calcium supplement. So the treatment, what is the treatment for such a patient? Well, the treatment is basically medication, and there are chances in which this disease may go away with the help of medication. Now, osteoporosis gets severe as delay. It is identified. It can get treated if you just pick up the disease while it's initiated in the person. But since it's a silent disease and it's hard to understand if a person is osteoporotic, uh, as the disease is delayed, then that means that it can't be treated. It can be controlled or monitored, but it can't be cured. It so a person has if a person has this disease, then the chances for recovery are not always full. But the medication helps, and there's a physical therapy in which we try to encourage the person to try to do his activity of daily living, try to encourage him, try to educate him, try to guide him in any way of living we can to him, and so he may continue his daily life. And uh, and there's a paper in which I have shown some exercise plan that physical therapist doctor use to give to patient some the treatment that they give. So we have exercise plan 1, 2, and 3, and I'm not going to go in the whole in the detail of it, but it's just for that the exercise 1 plan is for patients who have a less risk of getting fractures, and or if they have a fracture but it's not that severe. And the exercise 2 plan, it's like 10 to 19% of major risk fracture, meaning it's a moderate or medium risk zone. And the red one is an extreme risk zone in which the patient is to be treated very delicately, and and to be observed while he's doing exercise or trying to do exercises, so he may not stress his bone as much, so as they could be harmed and they could break and fracture may occur, because it's a very deadly disease again, because it can lead to death, literally. And other than that, it's very painful. If you have fracture, the fracture won't heal. Like if a fracture heals in a person in about 4 to 8 weeks, or depending upon the severity, 4 months or 6 months, then just imagine if you have this disease, your bones are shallow, and if you get hit and there's a fracture, then it won't heal. So I just wanted to educate people about this disease, and hopefully it would be beneficial for you to learn from it. Thank you.